Monday on Home and Family, the cookie book author Rebecca Firth is making delicious chocolate crinkle cookies. And Larissa is giving us a preview of the American Rescue Dog Show.
Welcome back, everyone. February is National Pet Dental Health Month, and Larissa is here with Dr. Courtney Campbell to share all the important information and tips that we need to properly care for our pets. We appreciate you being here. Thank you so much. Both of you, of course.
Both of you having me. This is important.
Yes. Well, it is important.
Yes.
I mean, caring for our pets' teeth, you say, is extremely important for many different reasons. One of the reasons is the fact that it can lead to serious and dangerous medical conditions.
Listen, not only could it lead to serious and major medical conditions, but it's the most underdiagnosed medical condition that there is in pets. And the reason is people aren't just at home lifting up their pets' lips, right? They're just not doing it. And what's the big difference is between human dental disease and pet dental disease is that in pet dental disease, it can accelerate 5 times faster. And so in about 80% of dogs and 70% of cats will have dental disease by the time they are 3 years of age.
80%?
Yeah, 80% of dogs. But at the end of the day, the good news is there's a way to prevent it. You know?
Oh my goodness.
But Larissa, you even had a touching story about this as well.
You know this firsthand. Yeah, we all know it here. You brought Muppet in and she had that
You
crazy
remember,
infection.
I brought Muppet in for a segment one day. It was, I think, a Friday, and one of her eyes was kind of squinty. Like she was just trying, see? And I took a picture because I wanted to watch it because I thought that seems weird. Next morning, Saturday morning, woke up, she had blood all over the side of her face. Turns out she had a raging tooth infection that abscessed. And I mean, she always had bad teeth. So and I had taken her to get them cleaned, and it was smelling again. And the doctor said, let's wait a little bit longer because she just had a cleaning. I don't want to put her under again. And then that happened, and it was like, oh, okay. It's pretty amazing how fast it goes.
It's really fast, and that story has a really touching ending because that dog ended up getting treatment. But there are a lot of dogs out there who have abscesses or who the dental disease got so bad that they actually had a fracture or a break of the bone of their jaw. And then remember, all this bacteria that's sitting in the mouth, it'll go wherever the blood circulation takes it. So the body is just getting showers of this bacteria. It could end up in the liver, the kidneys, and of course the heart. So there are ways to prevent it.
Well, I was just going to say that we got a sense of the issue, the problem here, but how can we prevent this from happening?
Yeah, all right. Just like with people, brushing is best. And I know that there's people out there saying, wait, you want me to brush my dog's teeth? And the answer is simple. What would your teeth look like if you didn't brush them for 7 years? Or 7 days. So what would your teeth look like? So the brushing is absolutely the best. But I always tell people, take a step back before you start brushing, and it's important to know normals. How can you figure out what's abnormal unless you know what normal is?
Correct.
So go ahead and lift up your dog's lip to see what things look like. And we've got a picture here, and that picture, I want you to focus on 3 main things: the gums, the surface of the tooth, and the color. The gums should be nice and tight around the tooth, and in this picture you can see that the gums are a little bit swollen and blunted. They're not quite showing that cuff, and of course their color, they're not pearly white. And fortunately on the surface of that tooth, now that's a normal tooth, right? See how tight those gums are? See how white they are? And there's no sort of red or inflammation. So know what normal is, and that's a normal picture.
So you said also cats have the same problem. Do you want us to brush our cat's teeth too?
If you can. Now cats are not small dogs. So I always say anytime they're totally different. So anytime I say if you're thinking about starting this, go slow, use lots of treats, okay?
Yes.
So people say, all right, doc, I'm willing to try this, but how do I do it? The answer is lift up the lip, you have the proper tools, and go slow. So proper tools are, you want to either use a finger brush or you can use a veterinary approved toothbrush. Now you say, why not just use a human toothbrush? Well, there are, they have a long angle. They've got the head of the brush conforms to the tooth, and they're softer. So you don't want to buy a human toothbrush because it's too hard.
Or human toothpaste.
Or human toothpaste.
Doggy
Good
toothpaste.
Point. Yeah, doggy toothpaste.
Is it poisonous for
Well, humans, it usually has a sudsing agent because we like to see the bubbles in the foam. And also it has xylitol, which can be very toxic. So buy a veterinary approved toothpaste because not only are they for dogs and cats, but they also are chicken and beef flavored, some vanilla flavored, which makes it delicious.
Yeah, I don't want chicken or beef flavored.
Yes, no, don't substitute your toothpaste for your dog's toothpaste.
You know right away.
Yeah, you don't want to brush your teeth with your dog's toothpaste.
You said go slow, but what if the animal, what if you've not been doing this regularly like other people? Because that dog clearly looked comfortable, right?
Yes.
I mean,
And that's a good dog. That doesn't usually happen right away, especially with rescue dogs who may never have even, they don't know this is a weird
They're not going to know what you're
sensation.
trying to do to them.
That's so good. And you're so talented with these rescue dogs and figuring out their personality, because what you want to do is make it a good experience. So, first things first, go slow, start out with a treat, or just lift up your dog's lip maybe 2 or 3 times a day. Then maybe introduce a brush, do one tooth.
Okay.
Come back later. Do another tooth. Come back later and maybe do the whole mouth by the end of the week or the end of 2 weeks. But it should be a gradual process. Take steps to say, treats, praise, maybe even peanut butter on the roof of the mouth.
Smart.
And the other thing that I know you had mentioned to me is let them play with it. Like it's, you know, you want them to associate the toothbrush as a positive thing. So along with the treats, even if you just leave it with them, you know, for a little bit, just to kind of get there, to learn what it is.
Sure. And I'd say 3 times a week is the bare minimum. If you're doing it any less than that, then you're not really getting the benefit. The gold standard, of course, would be every day, right?
Oh
but,
All right.
But,
well, slow down.
yeah, exactly.
Slow down.
A lot to ask.
And focus on the outside of the teeth. The tongue will take care of the inside.
Okay.
I mean, I know some people that don't even
And
brush
then,
their
you know, one of the questions I get a lot, and I had to learn myself as well about this, was anesthesia versus non-anesthesia pet dental cleaning. Because there are non-anesthesia forms, but I'll let you explain.
No, listen, that's such an excellent question and point, because the popularity of non-anesthetic dental cleanings has really skyrocketed in the past 10 years. And I think that's born out of worry. Pet parents are worried about putting their dogs under anesthesia.
And it's cheaper.
And it's cheaper, but keep this in mind. I want everybody at home to really focus on this. Non-anesthetic dental cleanings do nothing to fight periodontal disease. They are simply cosmetic. They don't get the bacteria and the plaque where the enemy lives, which is underneath the gum line.
Right.
I'm a nice guy, and I would never let you go underneath my gum line without some anesthesia, right? So just keep that in mind. Non-anesthetic dental cleanings are simply cosmetic. They don't really fight the enemy.
No, it's important information.
How often should we do the aesthetic version of the anesthesia?
At least once a year. There are some breeds like Lhasa Apsus, Yorkies, Maltese, Greyhounds who need it a little more frequently. And of course, Abyssinians. We can't forget about our cats, right?
All right,
once a year with cats as well?
If you can, yes. And I think that if you need to do it more frequently, remember, genetics plays a huge role.
Okay. Well, thank you very much.
Thank you, Dr.
I'm gonna finish
Courtney.
this up, and then I'm gonna go brush my teeth.
There you go.
I need to brush mine now.
Just don't use your dog's toothpaste. Yeah, don't use
No,
your
I
dog's
left the
toothpaste.
chicken flavored toothpaste in your room.
For more information, go to hallmarkchannel.com, everybody.
You all stick around. Up next, lifestyle expert Lauren Mack is showing us how to create a jewelry stand by reusing our old kitchenware. Come on back.
I've never done a